Hi, my name is Lisa Sikorsky. I'm a nurse practitioner student with South University. Today I'm going to be doing a head-to-toe assessment on my patient here. My name is Lisa. I'm a nurse practitioner student. I'll be doing your head-to-toe assessment.
And Cheryl Sikorsky, it's nice to meet you.
Thank you. How are you feeling today?
I feel great today.
Good. General appearance, the patient is dressed appropriately for the weather. She is clean, no issues with her appearance. Today we'll be doing her vital signs, blood pressure, respirations, pulse, and pulse oximetry. Everything is within normal limits, no problems with hypertension. We're going to assess her skin and see how she looks. All right, skin looks good, no issues, no bumps, no bruising, no lesions, no masses anywhere, no scars, no lesions. Next, I'm going to be palpating her head, looking for her hair, the texture, and assessing the asymmetry of her face. So she's got hair coverage all over her head. It's thin, it's nice, full coverage. No signs of masses, lesions, bumps on her scalp. Her face is symmetrical, her eyes are symmetrical, her nose is midline, and they line up symmetrical with her ears. No signs of tenderness. I'm going to palpate her temporal pulses. Temporal pulses are a +1. Next, I'm going to assess her trigeminal cranial nerve, number 5, and we're going to assess for TMJ. Can you open your mouth, please? And close your jaw. Open your mouth and move your jaw side to side. Great. Patient has no issues with her cranial nerve, number 5. TMJ is intact. Next, we're going to be looking at her facial cranial nerves, number 7. Can you please smile for me? Raise your eyebrows. Puff your cheeks. Great, everything looks symmetrical. Can you tell me, close your eyes please, and tell me how this feels.
Soft. I can feel that.
Soft?
Mm-hmm.
Great. The facial cranial nerve number 7 is intact. Next, we're going to be checking the cranial nerve number 2, the optic nerve. She's going to read off of the Snellen chart, and we're going to check her visual acuity. Read the bottom line for me, please.
C, D, F, C, K, O, B, D, P.
Great. Patient has 20/20 vision fields, and she does have contacts in place. Thank you. Sorry. Okay, next we're going to check her peripheral vision. We're going to move her my fingers. We're doing the 6 cardinal fields. It's the oculomotor cranial nerve number 3, trochlear cranial nerve number 4, and abducens cranial nerve number 6. Okay, tell me when you see. Let me wiggle. Look straight at my nose. Tell me when you can see my finger.
I see it. I see it. I see it. I see it.
Okay. Grab my pen light. Follow my pen, please. Perfect. Cranial nerve number 3, number 4, and number 6 are all intact. Next, I'll be using my pen light to check her cranial nerve 2 and 3 for pupil size, symmetry, shape, and response. I'm just going to shine a light, check your pupil response. Perfect. Perfect. Pupils are a size 4, brisk, reactive. Next, we are going to be checking for cranial nerve number 3 with direct light. Look straight at me, please. Perfect. Good. Cranial number 3 is intact. Next, I'm going to assess the eyes for conjunctiva. Look in her eyes and with the ophthalmoscope and see for symmetry. Okay. Conjunctiva is pink. No signs of redness, exudate, or erythema. No periorbital edema, and sclera is nice and white. Next, we're going to be looking in her eyes with the ophthalmoscope, looking for the red reflex presence. Perfect. Red reflex is present in bilateral eyes. All right. Now we're going to be inspecting her ears. We're going to be looking at the acoustic cranial nerve number 8. I'm going to be performing a whisper test where I will stand away from the patient, whisper some words, and she will respond to those words, repeating them to see if she can hear well. B, dog, C. B, dog, C. You can say it out loud. Okay. Cat, Monday, D. Cat, Monday. You're supposed to say it out loud. All right, great. Acoustic cranial nerve number 8 is intact. Next, we would be performing the tuning fork to see if we have equal connection with the noise. Also, the Weber test and the Rhine test. So what you're going to do, Cheryl, is you're going to tell me if you hear the sound equal on both sides of your head through your ears.
Yes.
Okay, next we're going to stop. We're going to do this. We're going to test the mastoid bone. This is the Weber test. Tell me when the sound disappears, please.
Now.
And now we're doing the Rhine test in front. Please tell me when the sound disappears.
Now.
We have an air to bone conduction of 2 to 1 on the right side. We're going to do this again on the left. Ready? Tell me when the noise disappears.
Now.
And again on the front, please.
Now.
Great. 2 to 1 conduction on the left ear as well. Next, we're going to be looking in the ears to assess. I'm going to take a look here with my otoscope. Looks good. Tympanic membrane. It's not red. I have a translucent clear sign. And again on this left side. Perfect. No signs of redness, and a clear translucent pearly gray on that side as well. Great. Okay. Can you tell me if you smell anything right now? We're assessing the olfactory cranial nerve number 1.
I smell perfume.
Perfect. I'm going to look in your nose with the otoscope. We're going to check. We're going to see if we see any type of lesions, redness, swelling, drainage, or masses in the nose. Perfect. No issues with that. Everything is clear. No redness, no masses, no lesions noticed in either nerve. Next, we are going to palpate the frontal and maxillary sinuses. Let me know if you have any pain or tenderness. Any pain or tenderness?
No.
Perfect, perfect. Next, we are going to look inside the mouth. Look at the lips, the gums, the tongue, the heart, and the soft palate. All right. Let's see what you got going on. Perfect. Patient has multiple fillings in her teeth. The tongue is midline, uvula is midline. No signs of redness on the tonsillary. Soft palate and hard palate are intact. Gums are healthy, teeth are healthy, and the lips are moist and have adequate saliva. Next, we're going to assess the glossopharyngeal cranial nerve number 9, as well as the vagus nerve number 10. Can you please speak for me? Tell me, count 1 to 5.
1, 2, 3, 4, 5.
Okay, swallow for me. Perfect. And go ahead and open. Let me look at, stick out your tongue. And tonsils. Everything is intact. Uvula is midline. Tonsils are without redness or swelling. Next, we are going to look at range of motion of the neck. So the neck, her neck is midline, intact on her shoulders properly. Can you put your neck down to your chest, back, to the right, and to the left for me? Perfect, perfect. Next, we're going to palpate the cervical lymph nodes, the pre and post auricular, occipital, submental, submandibular, tonsillar, subficial, cervical, posterior, superficial cervical, posterior cervical, and supraclavicular. All right. No signs of lumps or masses and no swelling of the lymph nodes. Next, we're going to palpate the thyroid. I'm going to have the patient tilt her head down, turn to the right a little bit, and have her swallow. Up a little. There you go. Swallow for me. Good. No enlargement, no nodules, or no tenderness of the thyroid. Perfect. Next, we're going to go ahead and look at the shoulders. We're going to palpate axillary, central, lateral, pectoral, and suprascapular nodes. Feel the nodes. Everything is intact. There are no signs of lesions, lumps, or any type of swelling into those lymph nodes. We're going to look at the shoulders for symmetry and palpate for tenderness. Shoulders are equal and symmetrical. Do you have any tenderness when I push here?
No.
Perfect. Perfect. Next, we are going to assess range of motion. Please shrug your shoulders up, push against my hands. Perfect, and they can go down. Spinal accessory number 11 is intact. And I'm going to go ahead and look at her elbows. And check for range of motion. Bend your arm for me and extend all the way out. Elbow on the right is good, intact, has good range of motion, no signs of lumps or erythema, and open up to the left. Same as on the left side as the right. Next, we're going to check her brachial pulses and her radial pulses. Hold your arms out, please. Brachial pulses are +2 and strong. Radial pulses, perfect, +2 and strong. Next, we're going to examine her upper arm strength. She's going to do a push and pull exercise so we can evaluate her strength. So you're going to hold your hands up like this, please. You're going to push up against my hands, hard, good job. Turn them over, push down on my hands, good. She has 5 out of 5 strength in the upper extremities. Next, we're going to move on to the anterior chest and start looking at her shape and her movement as far as her lateral diameter, and then we will assess her lung sounds and her heart. So you can sit up just nice for me here. She has a 2-to-1 ratio of AP to lateral diameter. I'm going to palpate and then listen to her carotids. We're gonna 1 carotid at a time, we don't do 2. Pulses are good, +2. I'm going to listen with the bell on my stethoscope. Perfect, +2, no signs of bruise. Next, we're going to go ahead and listen to her heart. I'm going to start at the aortic on the second intercostal, right of the midclavicular line. Move to the pulmonic on the second intercostal to the left of the midclavicular line. Next is the tricuspid at the third left intercostal space of the midclavicular. And the mitral valve is to the fourth on the midclavicular. S1 and S2 is heard, no signs of murmur, splinting, or S3 or S4. The PMI rate and rhythm is the fifth intercostal left midclavicular. A rate of 62, rhythm is sinus rhythm. Next, I'm going to be listening to her breath sounds on the anterior. Take a deep breath, please. Perfect. Vesicular breath sounds, no signs of adventitious breath sounds. Next, we're going to be looking at the posterior of her back. Can you sit to the side, please, and turn? Great. Spine is midline. No signs. She does have a few little moles and some freckles on her back. All right, so I'm going to palpate for tactile fremitus. Please say 99.
99.
Good tactile fremitus, no issues with that. I'm going to percuss the 6 areas of the chest wall, looking for resonance. Great resonance. Next, I'm going to auscultate her breath sounds on the back. Deep breath, please. One more. Perfect. No adventitious breath sounds. Lung sounds are all clear in all 6 areas. Vesicular breath sounds is what is heard. Sounds great. Perfect. Now we're going to come lay over here on the couch and we're going to assess your abdomen. We're looking for scars, lesions, any type of hernias. I'm going to lift up your jerk here. All right. Umbilicus is midline. No issues. She does have a little petechiae on her stomach and a couple little freckles. Next, we are going to auscultate for breath sounds. Excuse me, abdominal sounds. All 4 quadrants. Patient has active bowel sounds with tinkling. Next, we are going to listen to the vascular sounds, the aorta, renal arteries, iliac arteries, femoral arteries. First, I'm going to start with the aorta. We're listening to see if we hear any bruits. Renal. Iliac. And femoral. No signs of bruise in any of those arteries. Next, we're going to percuss the abdomen over the organs and then over the small intestine and stomach. Good. Dullness is heard over the solid organs, and tympany is heard over the stomach and intestines where there's air. Next, we're going to percuss the liver. You're going to feel me push against here. And percuss over the spleen. Perfect. Next, we hear dullness over those areas. Next, we're going to palpate the liver to see how large it is. Take a deep breath, please. Okay, the liver appears to be around 6 centimeters. Next, I'm going to palpate for aortic pulsation. have no signs of aortic pulsation. Next, I'm gonna do a light palpation on the abdomen and then do a deep palpation. Please let me know if you have any tenderness.
No.
Good, and now I'm gonna go a little deeper.
No.
Perfect, your bowels move regularly?
Yes.
Great, you can sit back on up and pull it on your shirt, and you can come have a seat over here. Abdomen assessment was benign. Next, we're gonna check her lower extremities. I saw as she walked and she got off of the couch that she was able to, and her hips are in line and no issues with walking. Next, we are going to ask her about her tenderness or any deformities, and we're gonna check her range of motion. Can you stand, please? Just gonna feel behind you. Hips are equal. Can you lift your right leg up, please, and down? Great, and your left leg. Any pain or tenderness in your hips?
No.
Great, you can have a seat, please. We're gonna look at her patella and her knees. We're assessing for redness, swelling, any type of injury to the knee, any old scars. Knees are not swollen, they have full range of motion, no signs of scars, and no redness or any tenderness in your knees? Perfect. All right, next we're gonna look at her ankles, assessing for swelling, redness, and Hohmann's sign. There's no swelling, there's no redness. Push your feet back, push towards my hand. Good, pull back, don't let me pull. Good. Push, don't let me pull. Good, negative for Hohmann's sign. Next, we're going to check her to see how her sensation is in her lower extremities. I'm going to be using a safety pin. I have a dull end and I have a sharp end. I will be asking her to differentiate between the two. What do you feel? Dull or sharp?
Dull. Dull. Sharp. 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 Sharp.
Perfect. She was able to differentiate between dull and sharp. Next, I'm going to use up here on her arms.
I feel sharp. 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 Sharp.
Perfect. All right. Next, we're going to check her popliteal pulses. She has +2 popliteal pulsars. I'm going to check her dorsal pedal pulses. Posterior tibial. +2 equal and strong, and dorsal pedal. +2 and strong. Her strength is 5 out of 5. She was able to push and pull accordingly. Next, we're going to check her neuro exam and her reflexes. So we're going to check the bicep, tricep, brachial, radial, patellar, and Achilles. Good. Perfect. Achilles. And Babinski. She's negative Babinski. Perfect. Now, I want to assess your coordination. You're going to take your finger, touch your nose, and touch my finger. And we're going to do with the same finger. We're going to do it fast. Go back to your nose, to my finger. Nose to my finger. Nose to my finger. Perfect. Patient experiences great coordination. Next, she's going to run her heel up and down her shin. Put your legs up here. Take your right heel, run it up and down your shin, and all the way down. Perfect. And then on your left, please. Great. Patient is showing great coordination. All right. Now what I'd like you to do is go ahead and stand up. You're going to bend over to touch your toes.
This way?
Sure. Forward. Perfect. Can you bend backwards now? Great. And then to the right. And then to the left. Awesome. Next, we're going to test our balance with the Romberg test. Stand straight, please. And go ahead and balance on your left foot, holding your right foot up. And then again on your, let's go ahead on your right foot and hold for your left foot.
I can't, wait a minute.
All right, perfect. Patient was able to perform the Romberg test. She definitely would need to increase her balance, and she was able to differentiate from sharp to dull. Overall, my assessment of my head to toe is benign. My patient has been a great person to work on today, and I appreciate her time, and thank you very much.
Thank you, Dr. Sikorsky.